women should have a choice, which is often caused as a missed disease. It is a missed disease. It is endometriosis.
I want to get some numbers. How common is this?
You'll be surprised to know this 1 in 10 women suffer with this. See, women are very tolerant people, At the same time, the monthly cycle, which is natural for a woman, it restricts them. That is the sad part of it. The woman prepares a bed so that an egg can come and get implanted. Has a pain. There is a pattern for this pain. So when I ask a question, when do you have pain?
What are the causes for this? Does it have any effect on fertility?
So sometimes you'll be surprised, the endometriosis may not be painful as well. You may not see endometriosis on scan. Actually, that is the gold standard of diagnosing endometriosis.
Let's talk about the condition of the women in India,
okay,
or rest of the world for that matter. How would they go about getting it diagnosed?
In England, it takes 9 years. In America, it takes 11 years. In Germany, it takes 10 years. In Wales, it takes 10 years. Like that, we have statistics. Not every woman needs a laparoscopy as well. It has an economical impact as well. I'm very happy for you doing this podcast, to be honest, because I want even men to listen to this.
The top gynecologist sitting here said that it can be natural. Without even her doing anything, she can get into pain. But now she got the pain. What she need to do? Doctors, what they normally prescribe for pain, which is the curing the symptom, not the root cause, I believe.
Yes.
Right? So curing the symptom is very important because at that moment, she is in pain. Let her relieve her from the pain and do something about it. So what normally happens during that course?
Okay, it's a quality of pain, quality of the person, quality of life, isn't it? Pain it disrupts everything. Personal life is damaged. When they have a pain, the first and most important thing is we have a pain ladder. We usually go with the small ones like a paracetamol. So most of them already try that, over-the-counter paracetamol they can try. And anti-inflammatory. All these spots and everything, what we're looking at, why they cause pain? They cause inflammation. So what are the tablets we have for the anti-inflammatory? Inflammation means nothing but it's a reaction where it will swell up, the blood flow will increase. In a lay terms to explain. Inflammation means it's some reaction is going on which irritates the area. So that is inflammation, in simple words. So what it takes away the inflammation is not paracetamol is not an anti-inflammatory, it's a painkiller. In India, surprisingly, they don't use paracetamol as a painkiller, but it's a very good painkiller. I want to stress that actually, they use paracetamol only for fever. But in England, I was surprised myself, when I came from India to this, when I came to UK, they're writing paracetamol for pain relief. And I was surprised, but it works wonderfully well. We give 1 gram, that means 2 500 milligram tablets 3 times a day or something like. So it's a good painkiller as well. So the paracetamol is a good painkiller. This is for people who are in India as well. They have to look at that as well. And some they say, I tried, it didn't work. And the next one is an ibuprofen, inflammatory, anti-inflammatory like ibuprofen or naproxen. All these are common names, okay? And then they call diclofenac, Waltrol. All that's the common names. They use them. These are anti-inflammatory medications, okay? So that will reduce the inflammation, that reduces the pain. But one thing you have to remember is these tablets, the pain, if they know that the period is going to come in 3-4 days, it's better even to start 2 days before. They should not wait for the pain to come. That's a good way of taking the painkillers. Okay, so like for example, the pain can start 5 days before. The women should be able to start early so that she won't suffer in that pain. Okay, but with these anti-inflammatories, what happens is they have to take after food. They can upset the stomach. So that is the one key point. Youngsters, they don't want to have breakfast. Teenage girls, they want to take an ibuprofen like that. So that can upset their stomach. So that is very important to know. So these anti-inflammatory tablets should be taken 3 times a day after food, 2 or 3 times a day after food, which is very, very important. If they are asthmatics or anything, they should have medical opinion. Because asthma, ibuprofen, these are not anti-inflammatories, can make their asthma worse. But the best thing, if they're not sure, they don't want to take the medication, they can go and see the doctor, and the doctor will give them anti-inflammatories.
That is the
ibuprofen, symptom-wise. In the same symptom-wise, The most important thing is, what is all this is happening? Is happening for because of periods. Why don't you stop the periods? Just stop the periods. And that can ease your pain. No periods, no pain. Okay? This is the point which comes, I want to stress again, when a woman thinks it is her right to have a period. But if you think, oh, you can't stop the periods, all the blood will collect inside. But the hormone tablets, whatever is given, they work on this where we started is the lining of the womb. Yeah? It doesn't form. So there is nothing to come out. I don't know whether you forgot my point. So basically, stopping periods is a type of pain relief as well.
That's good point. I want to ask two things in that. One, what effects one will have if they stop their periods? Would that have any effect on fertility? Can they still have
Okay,
kids?
that's a fair question. Yeah.
And the other thing is, someone who's really young, would it work for them? Let's say 22-year-old woman who found herself to have this disease, and the solution that you're offering is stop periods. Let's take her as a case study.
Okay.
And let's look at her from two angles. One, the physical aspect, which is the most important aspect. Everything else around it, emotional side of things, it's fine, we can deal with it. But let's talk about the physical side of things. What effects that she will have if she wants to go ahead with this suggestion that you made?
Yeah, that's a very good question. The reason the women has a period, I told you, when egg is released and all that. So when you are stopping the periods, you have to be selective. If someone is this 22-year-old lady, so some Mrs. X, if she wants to have a baby, then stopping periods is not a treatment for her. So the treatment for the pain relief or the endometriosis is tailored to the person. So when I see a 18, when I was doing my post-graduation, many years, in the 90s, probably we were not born as well. That time, what happens is, the situation is different, okay, like, we used to think that endometriosis happens only between 30 to 40 years when they try for pregnancy and all. No, it can start right from the day they start the period. So a 17-year-old, a teenage girl, this is what the studies are showing, the NICE guidelines, we have the NICE guidelines, National Institute of Clinical Excellence guidelines are common. They come out for all conditions in England, okay? I'm sure every country will have something like guidelines. Scottish guidelines are there like that. So these, right, when they came, this is what they were saying, like, you cannot say that it happens only in their 30s or 40s. It actually starts in teenagers. So when a teenage girl starts her, comes with painful periods, a doctor who listens to it should listen to the history. If the teenager says, I'm having pain 4 days before and during periods like that, then so the next question that comes is whether that may not be planning pregnancy. But a 22-year-old lady, your case, Mrs. X or Miss X, she may be planning pregnancy. So stopping periods is not her choice. Okay? So what we do as doctors, for example, is the woman has to choose what she wants. I just want pain relief. I don't want to have babies, or I need contraception. If she might be, in India, of course, they say marriage, but in this guy, things are changing everywhere. Women may be in a relationship. She needs a contraception as well, not to have a baby. So that woman, the best thing is to give the contraception, which also stops the periods. Every woman is different. Every age group is different. Okay? For example, let's start like the course of the baby. Okay, it will be much, much helpful. I think it will be more clear when I start like the journey of a girl. Okay, so 18-year-old who is suffering with painful periods, we need not even do laparoscopy because the waiting time for laparoscopy is too much, and also you don't even want to subject her laparoscopy, or mother will say, no way, my daughter is having an operation. So how do you going to help her? So first I'll tell her, please give painkillers so that she doesn't have any pain when she won't miss the school. At the same time, I, as a doctor, discuss with the mother, this is the pattern. This is how the endometriosis works. So if we stop the periods, then she will ask me the next question, how do you stop the periods? To stop the periods, we have to give hormones. For example, a pill is there. Why do people use a contraceptive pill? When they take a contraceptive pill, they don't release an egg. So they don't become pregnant. Okay? So when I use the word hormones, especially women from ethnic background or some Asian background, oh no, we're not going to have, because it has a lot of side effects. Yes, they have side effects. But over the years, there are more sophisticated, more efficient pills have come. Okay, which can have less side effects. Of course, this all should be done but only the doctor has to assess and prescribe. It's not like paracetamol. Okay, giving hormones should be done by a specialist. It should be done by a doctor, because we have to assess so many things. Okay, that will be another big podcast. So I just want to keep it very simple. So stopping periods can be done by giving hormones. Okay, for that they have to see the doctor. So one thing the women should remember is, there is a myth or I'll understand, oh, I need to, as you mentioned just now, what happens if I don't have periods? Basically, nothing happens if you don't have your periods. If you are given a pill, I'm telling about not having I'm not talking about not having a periods in normal, naturally. That is a different topic. I'm telling, by giving hormones, we are suppressing the periods. And it is reversible. For example, your 22-year-old lady is there, Miss X. She's not in a relationship. She doesn't want to have a baby. I'm very happy to put her on a hormone tablet. But she gets married, and when she turns 24, I'll ask her, stop the tablet. It is reversible. She'll start ovulating and she can have a baby. So that's what we have to tailor it. Okay. And then if you ask the pill forms, I don't want to go into too medically, there are two types of pills are there. The one pill has two hormones, estrogen and progesterone. There's another pill which is only one hormone, progesterone. These progesterone pills are much safer, because people with estrogen, they'll have more side effects like headaches and all that. Some people tolerate very well. So they think pill is bad. That I think I want to address that. It is not bad.
But whatever the two pills that you mentioned, this will be given only under the medical assistance from the doctor.
They have to go to the doctor.
So from the patient's perspective, the woman suffering in pain, from their perspective, approach the doctor and get the medical assistance. Okay. That's what they need to do. And from the doctor's side, you said that's what they do for the young. What is the permanent solution? Is there a permanent solution? Because as you said, if they stop the pills, the periods will come back. Okay, and as usually, the pain also will come back.
You'll be surprised, and it is sad to know there is no treatment for endometriosis. Everything is to suppress the symptoms. There's no completely clear. The only thing is the course of it is there's no. If, for example, this is all the temporary thing, and some people say, oh, I want to become pregnant. Is pregnant, because in pregnancy they don't get the pain. Okay?
It's because you're not getting
periods. But it's a misnomer. Some people think, oh, if you become pregnant, it'll get. No, pregnancy is not a treatment for that. Pregnancy is not a treatment.
Temporary relief.
It's a temporary relief, because the endometriosis, all these spots will be very quiet. So once she starts her periods, after she had a baby, it will start again. So everything is like suppressing. Okay, controlling the symptoms. But what can happen if a woman doesn't happen and nothing happens? She goes to see a specialist, and not all gynecologists are specialized in it. There are only few gynecologists who do special, to find the endometriosis through this camera. It should be trained in that. In England, there are specialists for endometriosis. I'm sure even in other countries, So I cannot comment or say anything what about the other countries, but because of my practice, I'm practicing here. I know many of the doctors, I know many of my friends who are practicing in India, they do laparoscopy, they're trained in endometriosis, and even in America. The reason is, everyone cannot pick up. It need not be always like how you said, like these spots, like a gunpowder spots or black chocolate spots. It can be different shades can be there. So to pick up that, you need training. So there is a specialist training. They have to have an extra 3 hours, 3 years training in this country. They have to become an endometriosis. So they do gynecology, they do medicine, they do become gynecologists, then they have to become endometriosis. So once the things are not happening, so they know that. So for a common person, I'm saying pain relief is very, very important. And the second thing is, if they are given an option to stop the periods, they should not hesitate to take that option. They can discuss with the doctor, what are my side effects? Can I take this? I have this medical problem. Can I take this? So they should keep their mind open, because what they want is the relief. And still, they want to know exactly the diagnosis. The next thing is laparoscopy. Okay. The other thing is, when they do the laparoscopy, the next part of the treatment is surgical treatment. We are talking about the medical treatment, but what is surgical treatment? The surgical treatment is, when they do the laparoscopy, if there are any additions, they take away all the endometriotic areas by laparoscopically, there will be pain relief. The women will have the relief of pain because all the spots are removed. So that surgery can't be done by normal gynecologists. Again, they have to be trained in endometriosis. Okay? So the laparoscopically, they remove everything. I'll tell you the practice in England, okay? I know this is not normal surgery. In England, there are some accredited centers. There is, they can look at it, that is called as, it may sound a bit different thing, but there are associations where British BSGE, British Association of Gynecological Endoscopy is there. That is all the job of the doctor. Okay, if I'm a doctor, okay, and you brought your wife to me or something like that, we tried everything, we want treatment, then I'll ask you, okay, I will refer you, but I'll tell you, I have to refer your wife to say, oh, she had laparoscopy, she had a diagnosed endometriosis, everything has come back. Then I'll say, okay, Mr. Chandu, where do you live? I'll ask you, where do you live? If you say, I live somewhere in London, okay, which area you live? So this website, there is called BSGE. I'll go onto the website. Even if women also can go, you can easily access that website, okay? BSGE website, you go, and then you can look at London, who is the specialist there. And you'll tell them, this is an endometriosis center, I will refer you there. Then your next question will be, what is endometriosis center? Am I right? It is a center where the gynecologist is specialized in that. And when they do the surgery, there should be a colorectal surgeon. It's an MDT, multiple discipline. Colorectal surgeon will be there. When the person is operated, when the woman is operated, there will be a urologist. Everyone should be there, because we don't know, because they're removing, they don't want to damage the bladder, because if the endometriosis spreads so much inside, so there'll be a lot of additions. You can easily damage the bladder or the tube which gets the urine. That is, we call it as a ureter. You can damage that. You can damage the intestines. You can damage anything in the inside organs. So that center will have a colorectal surgeon, a surgeon who specializes on the intestines or the bowels, and a urologist, and a gynecologist, a pain specialist, and psychologist, a nurse. Everything will be there. So that is the beauty of that endometriosis center. We refer them, they remove everything, and the patient may be happy.
Is there a specific age group of patients or women that will be referred to those centers, or anyone who wants to take, I'm not saying permanent cure, but it certainly is a long-term cure than your painkillers for sure, and contraceptive, even pills, I assume from what you said. So is there an age group, or anyone can be referred and can go and get the treatment?
It's very difficult to say. A 22-year-old lady may be suffering a lot, okay, than a 40-year-old lady. So it's very difficult. So we have to, first they try the conservative treatment. If there's no relief, our life is becoming miserable, I work with patients. I'm actually a volunteer in the Endometriosis Society. I go to the meetings with the patients, local meetings, then they will, you see them suffering, like that. So when the suffering goes bad, that is what a doctor should do. What I created a slide for GPs, for 3 Ps for GPs. So when the patient comes with this pain, pelvic pain, please listen to the patient. Listen, learn, and lesson. So you listen to the patient and you give whatever you do, you give. But keep your low threshold. She's saying, I'm not getting better. Oh, carry on, carry on. We can't say that, We have to refer them because already the waiting time is so much, we have to refer them. So then you refer them and they will decide then to the local, if you have a high suspicion of endometriosis, you send it to the lower. It's not the age group, it's the way the person is suffering and what she wants as well. If she wants to have a baby, I can't say, okay, I'll give you a pill and stop your periods. I will refer her to hospital.
Thanks for covering, in detail about the causes, symptoms, and possible cure that is available for the endometriosis patients. Now, for a woman, it's just not her. There is so many things revolving, especially people around her. As a partner, what one can do to support, and as a father, because
Yes.
it's very important for them to understand that someone is going through a natural course of ultimate pain. As you said, there is no reason. It could happen to anyone for whatever the causes that you mentioned. So let's start with a partner. What a partner can do to support his or her women in their life.
This is the best question, I feel, in the conversation we had. This is what my intention of doing this presentation as well. Women suffer, okay? It's not that they're seeking sympathy or anything like that. What they need is someone to understand why they are in pain. First of all, as I said, it's sad that women herself doesn't know that why am I suffering this, okay? Once she comes to know, yes, I probably have a condition or something like that. What the partner, whenever they see or something, it is nice for him to know this condition is there, because I'm sure many men don't even know about this, not even heard about this condition. They should do a little more, into what this condition could be, how it's affecting. Why the man is interested is, one, he's seeing his partner suffering physically, not able to do things they want to. For example, they want to go on a bike and then enjoy the weekend. For example, today is a very special day, they want to go for a Valentine's Day, they go somewhere, something like that. But the woman says, no, I'm in pain, I can't come. So that is one physical symptom thing. And the second thing is, the man wants to have a normal sexual life because they want to plan pregnancies, and then the partner, the man means, the partner, they want to have a family life. They want to. So all these are stopped by this condition, sad condition. So first of all, he should know about that condition, okay? And he should be like, for example, the days when she had a bad day or something, you should make sure that he supports her in the house with the housework or whatever it is. And being empathetic is very, very important. Yes, I understand your pain. Yes, we'll go through this journey together. Yes, I want to come to you with you to the doctor. Sometimes when I do a telephone consultation, and I think it could be as a endometriosis, I usually say, whatever, why don't you bring your partner? Oh yeah, my boyfriend is working. Okay, make an appointment when he's around or he's not there. So if he's around, please bring him. I would like to see you together. So my consultation, usually I'll see them together. Okay, so seeing them together for doctors or the medical people will help a lot, and the person, and also the partner himself should say, I want to come with you for the consultation. Okay, and the second thing is, when she going through these treatments and all, she may feel have the fatigue and all. If they need extra help, they may have to ask these parents or her parents and some support, whatever support they can afford, they should be able to get that help for her. Okay, and another thing is, she should not be, for example, she's having pain with intercourse. Okay, and what the normally I see is, there will be relationship problems. He thinks she doesn't love her anymore. Okay, it's a simple thing actually. She tries to avoid intercourse because she was in pain. So the partner should ask, why? What? Then she may say, no, my experience is not good. I'm having pain. Then he should think, oh, why is she having in pain? How can I help her? Then they think, oh, we should see a doctor. There could be other reasons for painful intercourse, but at least why is she avoiding? That question should come rather than saying, "Oh, you don't love me, you don't do this," or something, blaming her for everything, what is happening and all that. And that causes, already she's suffering and she has no support, and now the relationship should break. Oh my God, many of them suffer with severe depression, these women. And one most important thing is relationship. A women with a very good partner and a good relationship, they'll do extremely well. They can sail through everything. So my discussion would be, the partner should, why one is why she's in pain, why she's having so much tiredness, why she's not able to have a normal sexual life. That's another thing. And fourth, why they're trying for a baby is not happening. To have a baby, only the women will be responsible for 30%. 30% a man is responsible, and 30% both of them are responsible. 10% no one knows the reason. But in our, especially in the cultural thing as well, everyone blames the women. Oh, she's not having baby. No, who knows? The man may not be having sperms. We don't know that. Like that, So what I'm trying to say is, so when they're not conceiving also, they cannot blame the women. Okay, that's very important. Okay, she had babies. She's doing extremely well. As I said, the endometriosis can be at any age. Okay, so after she had 2 babies, fine. And then she starts with the painful periods and all. That also, even at the age of 40 as well, the listening to the women is very, very important. Why is she in pain?
Sure. That's a partner side of thing. Because as a father also, I think there should be a role that they should play.
Of course.
Please, can you share something?
You'll be surprised to know, recently I had been to a very special meeting. I was surprised that the fathers accompanied the girls. The understanding, the knowledge has gone up because of this media or something. If like, for example, my daughter is there, if she's in a pain or something, because I'm a gynae, it's okay. But a father cannot see his daughter in pain. It's very sad. Not any family member, if some of the close family member, loving member is in pain, nobody can bear it. So immediately now what they do is, they also look at it. Better you take the doctor, or what is happening, or if she comes with a diagnosis of endometriosis or something, how can he help? Should think like that. And you will be surprised. As I said, I have seen fathers accompanying them. They go through. But sad part, what happens, the sad stories I've seen is, a young lady, she'll be in a very good relationship and all, but unfortunately because of this condition, the relationship will break down, and she has no help, only her parents, her mom, and of course mom is always with that because she can understand. The mom and father will be there for them.
Thank you very much, Dr. Uma Marthi. It was a pleasure talking to you, and the information as you shared, as I said, is worth $1 million, especially for men.
The first of all, Chandu, I want to congratulate you. The reason is, being a man, the first time I've done podcasts before on endometriosis, I've done a lot of guest lectures. Always, the female doctors asking me, can you do a guest lecture? For the first time, you asking a man is doing the podcast, that itself is the first important thing. I want to really, I'm very pleased. And actually, I praise the whole team who is actually recording and photography side as well as the audio side. All of you are men. And you have selected a topic for a women's health program. So this is a really, I feel really honored today because I'm being interviewed by a man, because this understanding of women's health problems by men is very important. Not just think, there are so many hundred, and we can do more podcasts for all the women's health problems, but everything, like if the same vice versa as well. If the man has some problems with this, the woman should be able to understand. That is how a healthy relationship should be. So that is the first thing I want to congratulate you.
The very reason why I want to do this is, why not me? Why not me?
Yes.
Why there should be a difference between men and women's health problem? Why a man can't accompany women when they are having these conversations? It's biology. It's nothing to do with your emotions. It's nothing to do with your culture. It's a biology. It's a course of natural things that are happening. And for natural things, everyone is open to know. Everyone is open to learn. So that's the reason why I wanted to do it.
Yes. I hope this is very helpful, and I really sincerely think women should never suffer in pain. They don't deserve to suffer in pain. Thank you very much.